what drew me to nursing was that I wanted to be able to spend more time with my patients. I kind of think of being a nurse right now as, having the ability to run a marathon or to be, this elite athlete. We need nursing instructors. There's always a place for you.
Produced by Podcast Architects.
Welcome to Healthcare Calling. I'm Chelsea Reber, and today I am joined by Karla Ross. She is the Director of Associate Degree in Nursing at Blinn. If you're interested in learning more about Blinn's nursing program, check out the link in the description and head to their website. Karla, thank you so much for joining us today.
Yeah, absolutely. Thanks for having me.
So tell us a bit about yourself and how you got involved with Blinn.
Absolutely. So I have been a nurse for about 16 years and sort of fell into working at Blinn just by working at the hospital. And whenever I was working at the hospital, I worked with nursing students. And that's really what kind of got me here. I never, ever thought, if you asked me 20, 30 years ago, what did you want to be? I would have never thought that I would have been sitting here working at a community college, working as a teacher. Sort of just happened. If I look back on my years, it was a really gradual process. I actually started college wanting to be a doctor. I thought that I liked healthcare, and I really enjoyed helping people, and I think that's how a lot of people get into nursing. They say they like helping people, but I wanted to go a little different direction once I got into college. I think a lot of people end up deciding that potentially as well, and that's led me into nursing, and kind of talk about that a little bit later, but once I was working as a nurse, I started working with nursing students. And that was, something that sort of, in the monotony of the day, potentially, it became a little bit of a light. It was a joy to work with nursing students because you kind of saw that light bulb go off. And that was a lot of fun for me because you sort of remember back whenever you were a nursing student and how scary it was. And I kind of enjoyed getting to mentor them and to see them get excited about being able to do something for the first time. And, one day I just ran into one of our nursing instructors and she happened to catch me. I say at a weak moment, but she caught me and was asking what I was doing with my life. And I, pondered, what am I doing with my life? And, that's basically how I started this, introduction into Blinn and started working here. So
I do want to go backwards just a little bit. You talked about thinking you wanted to be a doctor, but then making the change to nursing. What really made you want to become a nurse and get into this profession?
I think what drew me to nursing was that I wanted to be able to spend more time with my patients. I loved the idea of being able to spend time at the bedside with them. I still work at the hospital. I work on a medical surgical telemetry floor. And so whenever I'm spending time with my patients, I actually get to be with them for 12 hours at a time. And, whenever you have, patients that are sick, they're waiting for someone to come in the room. And the doctors, they'll come in, they'll come out. The, dietitians come in and out. The physical therapist might come in and out. But the nurses are there all day, taking care of the patients. And I've truly seen where nursing care has made such a difference in the lives of my family members. And healthcare professionals in general obviously make such a difference. But, my grandmothers, both of them were nurses. And I think that's really kind of what drew me into that bedside nursing. And that's what sort of piqued my interest initially, and made me sort of see that role so differently. And whenever I was able to, like realize, oh, that's really what's happening. Like nurses can take something, and maybe it's not even, I don't even know what's really going on with them, but I know that they don't feel good. I can do some interventions, and I can make them feel better by the end of my 12-hour shift. It was very, very empowering for me, And my grandmother, one of my nurse grandmothers, lived with us for 7 years. I say she lived in our dining room. And so she became ill whenever I was little, and she lived with us. And, there were times where she was in and out of the hospital a lot, and I saw the nurses come in. And you could kind of know when you had those nurses that were just in and, they came in, did what they needed to do, and left. But those nurses that came, they spent time with you, kind of got to know you a little bit. I think that's really what made me want to become a nurse. Because that's, what's making a difference in patients' lives. And initially, whenever I started working, that's, what I fueled the fire, I guess, whenever I first started, because it can be, kind of overwhelming. But those few moments that you have where you connect with those patients and you can make a difference, kind of keeps you wanting more.
You talked about that weak moment, and that was the start of the transition from nursing to more of an academia role. And I know you still get to do some patient care, and so you are still around patients. But tell me more about that transition and why you decided to make the leap into academia.
Yeah, so, whenever you're working at the hospitals, you do spend a lot of time, a lot of effort, a lot of energy caring for patients. And, right now there's so many opportunities in nursing, and that's the beauty of it. Sometimes in your life there might be times where you might need a change just because of what's going on in your family. And at that time I had a really young daughter. She was a year and a half old, and the 12-hour shifts weren't necessarily working the greatest with our family life. And it was just gave us an opportunity to, try something new, see if it worked for our family. So from that aspect, it was like, okay, let's try something new. But I think from a professional aspect, those moments that I had with those nursing students where I saw that spark and I saw that, them respond whenever they got to, maybe start an IV for the first time, and you got to, feel like, hey, I had something to do with that. Like I got to help someone. I just felt like, could I help people even on a bigger scale if I was helping maybe not just one nursing student every shift, but maybe helping 30 or 40 nursing students in a classroom, kind of piqued my interest. Maybe that was something that, that could be maybe something even bigger than I thought that I could do. And it made me really nervous because I'm a very shy person inherently. So I thought, I don't know, is this really something that I could do? So I stayed working at the hospital PRN, and I started working at Blinn, because I thought I'd just keep one foot in the door just in case it doesn't pan out, because I don't know if I can really do this. But, kind of like I said, it was sort of that weak moment where I thought, let's just give it a go. Try something new. It's very odd for me, actually. I generally am not that kind of person that, does something crazy like change jobs, but something was pulling me towards that. And I think it really was just those experiences that I had with students. And, once I had gotten into the academic world, I really fell in love with, I think the energy that you have with working with students, because students really, they want support. They need encouragement. And I kind of, I felt like I wanted to be that for them. A lot of times they don't even know what they don't know. And to be able to sort of say, okay, I've been there, I've done that, let me help you through this, and to be that support person that sort of, even though it was scary for me at first to do something new, I think that helped me decide that this really was what I wanted to do.
When you hear the word nurse, I feel like it kind of goes hand in hand with the phrase patient care. And already, just in the few minutes we've been visiting, you've talked about caring for patients, listening to patients, being with the patients more than anyone else in the hospital at that time. And I think patients, there's so many of them that just want to be heard. And sometimes when a doctor, or as you mentioned, a dietitian, they're in and out, there's just not as much time for conversation. And so as a nurse, how do you make sure that your patients are being heard and that you're listening, but you're also, trying to help them and make them understand what the best decision could be for them and their health?
Right. There's so many times where, especially you have patients in the hospital where I'm predominantly worked, that I think they get to a point where they're at their lowest a lot of times. They're feeling, they're feeling so defeated. They're feeling so down, like, it's never going to get any better. It's, and I've worked with oncology patients a lot as well. So they really are at such a low point. And so to be able to go in and to provide them some encouragement that they can improve their situation. Possibly, maybe one of the biggest things that I get them to do is to get up out of bed. And they don't want to. It's something that they hurt, or they don't see why, what's the point. But one of the things that I've done is tried to, figure out what motivates them. One time I had a patient figured out what motivated them was ice cream. So
that motivates a lot of people.
Motivates lots of us, right? So we went and, scrounged up some ice cream and Dr. Pepper and had, ice cream sundaes and ice cream floats because and wheeled him outside, because doing something like that was able to get him moving and bring a smile to his face. And he felt so much better, by the end of the shift, being able to see a smile on his face, smile on his family's face. And that's took a little time to figure out what could motivate him to get up and get out of bed. But that's kind of those things that I think as a nurse, I sort of live for, finding those motivating factors to get them, up out of bed or whatever it is that I know that they need, but they probably aren't going to do on their own. But they need that encouragement, because then the next day, maybe they will, because they know that it's going to make them feel better.
Mm-hmm. Do you want to learn the 5 steps you must take now to prevent attrition in your nursing staff? Click the link in the description and fill out the form to receive our informational sheet. Now, Karla, when you first became a nursing instructor, were there any situations that you did not expect to see?
It's been so interesting. I've probably seen some of the most positive things being a nursing instructor, and probably some of the most, negative things being a nursing instructor, and probably some of the most humorous things. But I'd say, on a positive side, nursing instructing, I've seen some students who have just surprised me. They have been able to dig in charts and find things that have surprised, and they found allergies that doctors and nurses and nobody else has caught. And I have been so proud of nursing students. It has been amazing to me that nursing students can advocate for their patients, and that was something I think that probably surprised me more than I thought. I just, probably because as a nursing student, I was so scared of everything. I remember the first time I ever needed to start an IV, or I knew my patient was going to need an IV, so I went and hid in the bathroom because because I knew they were going to need one, and I didn't, I wasn't ready.
Gotcha.
But no, these nursing students, they are, they're awesome. They are advocating for their patients, and they are, they're digging in charts, and they are sitting with their patients and just loving on them and doing the things that they need to do. And so some of the most positive things that I think have surprised me, on another, probably something that's probably surprised me being a nursing instructor, probably more a negative side, just, pluses and minuses of healthcare. So you just have to throw it out there. But I've seen some nursing students that just haven't been as welcomed to the healthcare sites. And that's something that I think, it is hard for nursing students to put themselves out there. And we've all been a nursing student at some point. We all have to learn somewhere. And but healthcare right now, it's hard. Everyone is stressed, and we don't have enough help. And so bringing in students, sometimes it takes more out of us. It's help, but it kind of takes more out of you, right? It's like whenever you get your kids to help you clean the house, it's help. Sure, it helps, but it's also, kind of takes a little bit more
Sometimes
effort.
It feels like it creates more work.
Creates a little bit more work.
Yeah.
And so, I think that that's something that sort of surprised me. Sometimes I see them not be welcomed as much as I wish they could be welcomed, because we've all been in that situation where we have to learn, and we want those students to be welcomed with open arms, because we've all been there, and we need them. We need them to love the profession as much as we do, and we want people to come in and have a positive impact. So there's problems everywhere, but to see how we can make changes and how we can be a difference, that's really what I hope to see. So anyways.
What is one of your favorite moments that kind of helped change your perspective while at Blinn? What's one of those moments? I want to specifically about being an instructor.
Yeah.
That you thought, wow, this was worth that leap. This was the right decision for me to move into this position, and not necessarily just stay in the nursing field, but to lend my knowledge and to teach new students.
So I think the best part about what I do is the fact that I not only am the director of this awesome program now, but I still work in the hospitals. And so I get my best moment quite often, a lot of times whenever I work. And I get to work alongside the nurses that I have taught in the past, over the past 12 years that I've been a nursing instructor. And but to be able to sit in the nurses' station and have that moment where I can look around the nurses' station and to sit back and to see the nurses that I've taught before, and they're just rocking it. They're doing so good. They're being the charge nurse, and they're being the house supervisors, and they are being the managers and the educators, and they are doing such a great job. And I think every time that I work, I have that moment selfishly, just to sit back and to see them. I feel so proud of them, and the work that they have done. They've made such a difference in the community and in healthcare. And I think that moment, it's all worth it.
Mm-hmm. You mentioned it's a tough industry right now, and it has been and will be, right? It is. It's difficult. But what would your advice be to somebody considering going into nursing, or that might even be in the program right now?
I kind of think of being a nurse right now as, having the ability to run a marathon or to be, this elite athlete. Like it's kind of an elite club. Like, and you have to get to the point that you can build yourself up to that, that status. And if I was going to be able to run a marathon, I'd have to train for it. I'd have to eat the right things, and I'd have to train, like do the workouts. And I haven't run a marathon before because it's painful to train. It hurts. I have to give things up to do it, right? Whether it's time or whether it's the energy, time with my family, it's going to physically hurt to train to get to that point where I'm physically and emotionally and, spiritually ready to be that type of person. And I think to get to the point to become a nurse, you kind of have to train and be ready to do that as well. We're seeing a lot of people leave the profession, I think, because they think that there's a fast track to getting to that point of becoming a nurse. There's no fast track to becoming a marathoner. If I skipped out on my training, right? If I said, you know what, I'm not going to train. I'm just going to go out there and run 26 miles today and see what happens. I'd probably quit, right?
Yeah.
I'd quit halfway through or more, less than, I just quit because I'm not physically prepared or emotionally prepared for that. And I think that to some extent, that's some of what we're seeing. Now, obviously, there's a lot of external factors as well. But as a nurse, I see the external factors and I want to change them. Like I want to be a part of the change. I want to, see if we can get all these healthcare providers together in a room and let's start making a change because our patients need us. We can't just leave them. People are going to still get sick. And I don't want to leave the profession because then where's that going to do to my patients? And so I want to do everything I can to learn all the knowledge that I can to train myself, so I'm ready and prepared to be the best nurse that I can be so I can take care of them, so I can know how to make a positive difference in the profession, in healthcare in general, in, whether it's to help change laws or whatever it is, so we can try to do the best we can for our patients. And that's, so for those of people who are in the profession or looking to be in the profession, no, there's no shortcuts. It is not a painless process. You're going to have to do the hard work in nursing school, but not just in nursing school. There's lots to learn after. And it's not just knowledge. It's not just the skills. There's a lot else. Other things you're going to be having to do. You're going to have to learn how to deal with difficult people. You're going to have to learn how to deal with long shifts and time away from family, how to learn with grief, how to learn with the emotions that you're going to be dealing with. And, you're going to have to learn new coping mechanisms. You're going to have to learn a lot about yourself to become a nurse. But if you can do that and get to the point where you can become that great nurse, then hopefully you can in turn help make a difference and a positive impact on the profession. And we need that right now because we've got to make a positive impact. We can't keep going like we're going and allow healthcare to go in the direction that it's going. Our patients can't afford that to continue to happen. And again, we're going to keep having patients because we're all going to keep getting sick and people are going to need us. And so we can't just keep leaving the profession whenever things get hard.
To make great nurses, there have to be great nursing instructors.
That's right.
And so in the same vein, what would you tell somebody who is considering making that leap to academia like you did?
I think don't let the thoughts of, I can't do this creep in because there we need nursing instructors. There is always a place for you. There are so many opportunities. You don't have to be full-time. You don't have to be part-time. We have the, part-time PRN status essentially, where you can kind of come trial it out and see if it's something that you can do on an hourly basis. And so don't let those, those thoughts of, can I do this, creep in, because I always say, well, my mom will tell you that I wouldn't even ask for ketchup at McDonald's as a kid. I was so shy. So to be doing something like this now would never been, thought of. So just the idea of, do you want to help people make a positive impact, support students? We need you. If you're willing to support students on an individual basis, on a larger basis, we need instructors who are willing to make an impact. You don't have to have a master's degree to be a part-time clinical instructor. Sometimes people are like, I just can't go back to school. That's something that's stopping them too. That's a barrier for them. You could be just a clinical teaching assistant and just helping clinical, if that's something that would is a barrier, or you can be work in the labs, and that's something that a lot of people kind of get nervous about. And so there's so many different opportunities to work with students, and maybe working as a mentor with students as well. And so we just want anyone who's willing to help work with nursing students to consider it, because there's a huge need to get more students into the nursing pipeline. We've got a lot of people who want to be nurses, but we don't have enough, capacity in our clinical sites, and we don't have enough capacity in nursing schools around the state, around the country. And so just to consider it.
Well, Karla Ross, it has been an absolute pleasure. Thank you so much for joining us today.
Absolutely. Thank you so much for your time.
Make sure to check out all the information in the description to see how you can learn more about Blinn and get the 5 steps you must take now to prevent attrition in your nursing staff.
Thank you.
Produced by Podcast Architects.